unfortunately, the place that we were operating from was not anymore a safe area, and we had to stop working from there. Unfortunately, we were not able to find a suitable place yet. We are trying for about 1 month, and the difficulty is because there is a huge housing problem. I think 70 to 80% of the houses were destroyed. We continue to look for a place, and hopefully we'll find one soon. However, not being able to have a physical place where we work for didn't really stop us from continuing our operations. Throughout the days, we continued to provide psychological first aid, and we were extremely happy that we managed to equip our teams in April and in May with 800 PFA kits, 800 psychological first aid kits that all went to families of the displaced people, most affected people in the middle areas and the southern areas. What's really important to say is that for our kits, we are extremely interested in two components, of those kits. One is toys for the kids, and the other is some sort of stationery that allows kids to draw, for example, to color things, for example, it's mainly crayons, pencils, and drawing books. And there are some of those drawing booklets, they have already a drawing, but you need to color them, all of those nice little things. And the feedback was extremely uplifting, actually. Our staff really operated in very difficult conditions and very hard conditions. And I all the time keep saying that one of the things that drive us to continue the work despite all the difficulties is that sometimes you see the fruit immediately. In addition to that, we continue to provide the treatment services. We try to offer medication for those who need medications. The stock of the medications that we receive from the WHO and from ANERA is almost over. We are trying to find a new one. And we are in communication with many organizations. But again, the closure of the route or path to Gaza is a big difficulty. We continue also, in addition to that, to try to provide telephone counseling services. And we try to provide every now and then some care for caregiver sessions. The team also managed, and this is something that I'm really proud of, to deliver one training course to a group of people through the protection cluster. And that course was on the provision of PFA services, psychological first aid. For example, children can wake and scream during the night. Younger children, they cling and keep sticking to their parents, They don't allow their children and their parents to stay away from their parents. So they want to stay all the time with their parents because they feel that their parents can be a little bit protective. And then you see startled response, you see hyperarousal symptoms. They have difficulty in sleeping during the night. They can sit irritable all the time, not able to sit in one place. They keep moving from one area to the other area. This is for young children. Sometimes they have bedwetting. We used to see in the beginning some pains in the ankles, in the abdomen, especially with kids, that sometimes it stopped them from eating. But now there is a big problem with food at large. That food is not really available, unfortunately. For adults, it's extreme fear and anxiety and worry, because you never know whether your place is going to be affected or not, attacked or not. You never know the morning you will wake up or not. You don't know where you can find help to yourself, to your family. You cannot find means of supporting yourself and your family. You are not sure how you can secure a meal, for your family. And then signs of trauma, can see a lot of people who are really extremely anxious, extremely worried, start a response again. Some of them, they even have signs of withdrawal. They tend not to leave their places. They just lost hope. There's a huge feeling of despair, we are under attack for 8 months. The world is watching. Nothing is really happening. There are no signs that things are going to stop. We heard once, twice, 3 times, 4 times more than that. There are negotiations, but neither ended in a good solution. Also, physical symptoms appear sometimes, physical pains, especially in the back, low back, and ankles, and knees, for example, big or large joints. And we need also to keep in sleep difficulties, of course. Sleep difficulties is very, very important. And some of the things that happen is that we see some, people becoming somehow aggressive because they cannot take it anymore. They cannot handle more negative emotions. We need also to keep in mind that there are some people who are extremely vulnerable. These who were pulled from the rubble, for example, these who lost family members. We have more than 100 children who lost all their family members. We have almost 1,000 children who lost a limb from their limbs. I mean, the number of the injured people is over 70,000. The number of people who need immediate health evacuation, to be receiving support, health support, is more than 15,000. So these are extremely vulnerable groups. Women at large. They need to survive the aggressivism. They need to take care of the kids, and they need somehow to manage the family. So things are really unbearable for the population. Look, at the moment, we really do not talk about disorders because, many of the criteria for disorders difficult to apply or say it in another, not to apply when you are under such conditions. For example, let's talk about PTSD, for example. One of the group of criteria is called avoidance. So you avoid going to places where your house was destroyed or you were pulled from the rubble. But again, if that is a dangerous place, who will go there, So some of the criteria are very less likely to be, applied one way or the other. And you cannot say that they are there and then the person is really has a disorder. And at the same time, a lot of what happens now is part of the physiological response to extreme alarm and extreme warnings of things that can happen at any moment. We struggle with a continuous fear of something that is going to happen, and that fear is not imaginable. It's a real, it's a real thing that happens everywhere and every day and every night. So we cannot come to those people who are challenging the realities, who are moving on with their lives, struggling with their lives, trying to help themselves and their children, their families and their wives and their husbands, etc., and come and tag them. You are a disordered person. You have signs of PTSD. It doesn't work like that. However, we have seen some extreme conditions when children and adults were presented, for example, with severe dissociative symptoms, with symptoms of acute stress disorder that you cannot really ignore, that are clear signs of a disorder. Now, this is not many of the people, but it's still there. But however, what we say is that we wait until ceasefire is reached. We need to make sure that they are not left behind. We need to make sure that we find them. We need to make sure that we know how to address their needs. And we need to make sure that we have the capacities, the equipment, the medication, the intervention to be able to support them and to help. It's important all the time to take in mind two aspects. One is the impacting factors. In this case, it's the terror, the traumatization, the continuous attacks, the hearing of the bombardment, being pulled out of the rubble, being in a place that was heavily bombed, or just being sitting up, displaced, seeing your house destroyed, or just receiving a photo of your house that's not there anymore. So this various traumatizing effect is one part of the story. But the other part that we all the time need to keep in mind is the protecting factors. Sometimes we call them the mediating factors. Factors that first help people cope with the atrocities, with the difficulties, help people recover, and help people go on with their lives. Now, the problem in Gaza Strip, it's not since October 7th. It had been all for years and for decades that you have a problem with the mediating factors. So one of the things is that we see symptoms of malnutrition, for example, since day one. Maybe not the first few days, couple of weeks, but already we have heard about famine 3 or 4 months ago for Gaza and the north. And now things are alike in the southern area of Gaza Strip. So food is very important for our health. And it's not only for our physical health, but it's also for our mental health. I mean, good food with good nutrient supply is very important for our growth. And this heavily affects the growth of children and affect the way they think about things and the way they can, cope or challenge the realities. And then problems with sleep because of the continuous bombardment that anything can happen at any moment. And at the same time, when you are staying in tents, I think 2/3 of the population now, maybe more than 1.5 million people, they live in tents. And tents are extremely hot during the day and extremely cold during the night. And then we add the third component, which is very important, the social network that is around individuals and around the people in Gaza Strip. These were one of the top protective factors that we had. But many of the families are now, because of displacements, they are living in different places, or they are living together in very crowded areas and places, and they are not really capable of supporting each other. And let's keep in mind also the economic conditions. Prior to the attacks, 53% of the population were under poverty. So you can imagine now what happened there. PFA is not a specialized mental health intervention. It's a very basic one, a very simple one, but it's a very needed one. Some of the people have more resources have more accessibility to information, but others, they do not know what they can do. They feel paralyzed, they feel impotent, that they cannot do anything, and they cannot even dare to ask where we can find help. Sometimes when you go and provide them with that simple, basic information, you make a big difference in their life. And then one-on-one therapy is something that really works good in Gaza Strip. While sometimes group therapy is something that doesn't work in Gaza Strip. Because people know each other. If I tell you I'm Yasser Abu Jamei, you hear my family name and you live in Gaza Strip, you'll immediately know at least where is my neighborhood, in which area I live, and probably you will know one of my cousins. So I'll not be able to really speak openly in front of a group on what really happened, for example, when there is something specific that's there. So group therapy intervention that go into group therapy, I say, might not work, but group counseling services would work well because they can speak about things in general, but not to go into the very specific details or something like that. Well, PFA is a very basic intervention, but it's a very important one. People, when there are disasters, when there are atrocities, whether natural or man-made, they will probably be displaced. They have lost some of their beloved ones. Probably they themselves get wounded or something like that. And they will need access to help. what comes to your mind, all kinds and all types of help. And they will need also some psychological interventions. They might need some kind of support, some kind of education, psychoeducation, for example. And one of the main things that PFA tries to do is to help the psychologist, but not necessarily the psychologist, by the way. It could be anyone who could train on the PFA. It's not a specialized intervention, by the way. It's an intervention that is scalable, can be provided by anyone who received good training, and it's open to many community members. The idea is to meet the people who are the survivors and try to make an initial assessment just to, how are you guys? What are you doing those days? How are you functioning? So first you assess the situation. You look around, you listen to the people, and then if some emotions come up, you try to diffuse those emotions in a very simple way. You do not go into therapy, you do not complicate things, but you try just to help people deal with those difficult emotions. So look, listen, and then link. Link means you try to refer or you try to link the survivors to the available services. And those available services could be where they can find water, for example, where they can find health support, where they can find medication, or where they can find more psychological intervention, more specialized care. So this is the main idea of psychological first aid. But when you try to provide them, our experience from that work in Gaza Strip is because of the complexity of the conditions, because people were not exposed only once to the traumatic conditions, and also because people continue to live in the traumatic conditions, and this is whether during the current war or previously. So that's why we try to add more tools like psychological first aid kit, and here we try to address issues that are very important to the children. Children and adults alike, by the way, they live under extreme fear and horror for the last 8 months and more than 8 months. And this is for many reasons. On top of them is in one hand, attacks can happen at any moment. And in the second hand, there are no shelters. There are no safe haven, which means the total extreme feel of no safe place. No matter what time it is, no matter what place you are in, even if it's announced safe place, can be attacked at any moment. And that a feeling of continuous fear and in addition to being exposed to actual fear, because you continue to hear the bombardment, things happen around you. You have some relatives, for example, who were killed or injured or wounded. You yourself were in places that were affected, attacked, or simply you were displaced from your home and you don't know whether it's still there or not. Or simply you are living in a tent and you know that you are living, in terrible conditions with very difficult ways of or means of accessing even food or water or whatever. So the feeling of continuous threat should be broken one way or the other, because no nervous system or no human being can continue to handle that suffering. It's impossible. For how long you can really shake from fear? For an hour and 2 hours, can't go forever. So the idea of those toys is that there is a chance that those children take a break from the realities. They can a little bit reconnect with the safe time that they had, reconnect with moments that were, for example, at school, or they were, for example, at home, when they felt somehow safe and they were able to play, they were able to get engaged with their parents or with their siblings or with their neighbors or with their cousins in this collective play. A lot of that is really gone missing. And they said, these are mental health professionals, and they tell me, it's really uplifting. Our society is, despite all the atrocities, but they understand the importance of having some moments of relief, some moments where they can breathe, where they just feel that it's fine, that we are alive still. A lot of the children were not receiving the needed care because their parents are quite busy, quite taken away by the realities that are around. And the chance to offer the child the hug, or to ask the child to tell a story, or to even sit on the mattress or sit on the ground, sit on the sound and play with the child is something that is really important. And families, unfortunately, sometimes miss having them. Some of the stories that we saw is children who lost everyone in their families. The difficulty is not even to be able to listen to their stories, or be able to help them survive or emotionally get better. But the main concern is the fear of what happened to them, the experience that they had. And then the second question is where we can go, what we can do. And this is again a question that is not easy to be solved. Some of those kids without accompaniment, they are staying with families of cousins or their parents' cousins. Some of them are still, they don't have a place to go to, and they are like in small communities in Gaza Strip. These are the most difficult cases that you need to work with. I hope that the conditions will improve and they will allow us to do better for the sake of the children. But at the moment, what we can do is really just alleviate the pain and the suffering that people are going through. Well, in one hand, most of them, they already know what happened when you meet them. They already show some signs of distress. Some of them, they show extreme signs of distress. Some of them are completely mute. They do not really talk. They do not communicate. And in some of those cases, you can just sit in silence and ask the child if you would like to tell something or say something. Perhaps in the first meeting, they will not say anything. Perhaps in the second meeting, they will not say anything. But maybe in the third, fourth talk, you need to show a lot of patience with that. One very important factor is that when you deal with children, you need all the time to invest in their families and people around them. You meet that child once per week, twice per week, each time for maximum an hour. That's not enough at all to make a big difference. You need to involve people around the child. You need to tell them what they can do, how they can help, how they can help the child recover. We all the time tell people that restoring the normal life routine is the most important recovery mechanism for children. But again, we are forced to see the realities in Gaza. That is, restoring the normal living conditions cannot happen when the attacks are still ongoing and there is no ceasefire reached and the living conditions are extremely terrible.